Hello, my name is Shannon Lee, and I will be doing my physical assessment today. I first want to note that we have already done, or just as stated, vital signs, pain assessment, looking at grooming, nutritional status, appearance, and also we have looked at the patient's gait and posture. Okay, so I'll go on and begin by washing my hands. Okay. Go ahead and close the curtain. And I'll introduce myself. My name is Shannon, and I'll be working with you today. I'll be doing a complete head-to-toe assessment, if that's okay with you.
Yes.
Okay, do I have your verbal consent to go ahead and do your assessment here?
Yes.
Okay, so we're going to go ahead and start and inspect the skin. So we want to look at color, we want to look for lesions, we want to look at all the vascularity and look for any issues there. Then we're going to go ahead and palpate. We're going to palpate for temperature, for moisture. I'm going to assess the hands. I'm going to look at signs for clubbing in the fingers. While I'm here, I can actually go ahead and look at capillary refill. Okay, very good. Look for any signs of swelling, so any edema. Very good. I'm going to go ahead and look at your head and scalp assessment. So I'm going to look at hair distribution. I'm going to feel for the hair texture. I'm going to feel for any lumps. I'm also going to look and see if there's any signs of infestation. Okay. Next, I'm going to go ahead and move down to the ears. Okay. I'm looking for symmetry. I'm looking at the lobes. I'm looking for any signs of lesions, any signs of drainage. Okay. We're going to go ahead and perform the whispering test. Sir, I'm going to whisper in your ear and you repeat back to me what you hear.
Apple.
Very good.
Banana.
Very good. Okay. So we're going to go ahead and move to the face assessment. So we're going to look at, let's start with the eyes. So we're going to look at the eyebrows. We're going to look at the eye conjunctiva, the sclera. We're going to look at the eyelashes. Okay. I want to go ahead and inspect or palpate the lacrimal glands, which are going to be here, okay? And I'm going to go ahead and move down to the sacs, which are down here, okay? I'm going to go ahead and assess cranial nerves 3, 4, and 6. So we're going to start first with just looking at your response to light and accommodation. Good. Very good. Can you follow my pin light, sir? Very good. Alrighty, I'm going to go ahead and assess the nose and the sinuses. So I'm going to go ahead and assess the frontal sinuses up here, and then the maxillary sinuses down here. I want to feel and make sure that there's no tenderness. I want to assess for skeletal integrity here. And I also want to assess and make sure that there's no issues as far as any type of obstructions, like nasal passage obstructions. So you want to assess the patency of the nares. Can you look up for me, sir? Good, very good. So nasal passages are clear. We're going to go ahead and move to the mouth and the larynx. So I want to go ahead and wash my hands again. And I want to go ahead and put on a pair of gloves. Okay. So you want to go ahead and have the patient open their mouth so that you can assess for any type of lesions you want to assess for color. And go ahead and stick out your tongue for me. Good. Good. And you want to assess for cranial nerve number 12 as well. So you want to have them stick their tongue out. You want to have them stick your tongue out for me, side to side. Good. And you go ahead and use your swab to go ahead and use this to look at their tongue from side to side. Go ahead and stick your tongue out for me. Good. And you can look at the side of the tongue for that. Okay, so you also, when you're inspecting the mouth, you want to look at soft palate movement with phonation when assessing cranial nerves 9 and 10. Okay, and you also want to use your depressor to look at the inside of the cheeks and also the tongue, so you can better visualize the uvula. So, without having to put my gloves back on, I'm just going to wash my hands, and I'm going to use the tongue depressor. Go ahead and stick your tongue out for me. Good. That way you can get a full range of view to fully inspect the mouth. Okay? So next we're going to go ahead and move on to the face as a whole. So you want to do some tests to assess cranial nerve number 7. So I'll have you raise your eyebrows for me. Good. Can you puff your face? Good. And smile. Good. So with this, you want to make sure that you note symmetry. You don't want it to be asymmetrical. And from this, we can move on to the neck and the trachea. You want to assess for symmetry. You want to assess for proportions, proper proportions, and you're going to assess the thyroid gland by doing a swallow test, and that's going to be looking at central nervous system 9 and 10. Okay, so you want to note first if you see any type of bulging of the thyroid, and I'm going to have the patient swallow the water, and I should feel the thyroid go up and down. Right for me. Good. Good. And that is exactly what we've assessed. Okay. What we also want to do is we want to palpate the sternocleidomastoid and the trapezius muscle of the neck. So a way that I like to do that, I want to have the patient raise their shoulders as I give negative resistance. So go ahead and raise your shoulders for me. Good, okay? And as far as the sternocleidomastoid, you're going to palpate this here, but a good way of assessing those muscles also is to do the negative resistance again. So can you please turn your head to the left, please? Good, good. Okay, and to the right? Good. Okay, so we've got some good strength there. We're going to go ahead and move on to our lymphatic system. So first you want to note any type of bulging. Okay, no bulging. And we're going to start with the preocular, which is going to be here. Okay, and then the postocular, which is here. And then the occipital, which is back here. And then the clavicle chain, which is going to be along the neck here. Okay, and then the supraclavicle, which is going to be right here over the clavicle. Okay, so you want to know any type of bulging. We're going to assess the submandibular. Okay, that's going to be down here. And the tonsillar is going to be behind that, just behind that jaw right here. Okay. Next, we're going to want to assess the axillary lymph nodes, which are under the arm, and there's actually a cluster, but you can generally palpate them in this area. And you always want to do it on both sides so that you're symmetrical, even better at the same time so you can assess for symmetry. Okay, Good. You want to know any type of pain as well with those palpations. And then you have the inguinal, which is going to be right here on both sides. Okay? Next, we're going to go ahead and do the posterior chest. So we're going to go back here. We're going to assess the skin for any type of lesions. You always want to assess the skin prior to really touching the patient. You don't want to go in blind. So we're going to assess for any lumps, bumps, anything like that. Then we're going to go ahead and auscultate. Sir, could you take a deep breath for me? Good. Very good. Okay. And we're going to palpate, feel for any type of nodules back here. Okay. We're going to go to the front here. And again, we're going to repeat that assessment of just looking and seeing if you can find any type of lesions, any type of issues with the skin, any lumps, bumps. But what I want to do, I want to assess for equal chest expansion. So I'm going to be right here. Take a deep breath. Good. So we've got good chest expansion with the deep breaths. And I'll assess this way as well. Okay. So we want to listen to those lower lobes. Often those are diminished. But we want to make sure that we listen to those to make sure they give us any evidence of any signs of infection, pneumonia, anything like that, any fluid overload. So after we've done that, we want to also percuss the chest. Okay? And we do that with the posterior side as well. Okay. And you really want to just listen to resonance with that. And you want to look at, again, you want to look at color, you want to listen to the lobes, you want to do all of that. Next, we're going to go ahead and assess the heart. So we're going to, let's go ahead and do some auscultating here. Okay. And we want to listen for S1 and S2 heart sounds. We want to listen for any type of like brewing, any type of murmurs. Anytime we're looking at our patients, we want to notice any feel for the thrill is what I like to use to remind myself. But for instance, if somebody had a dialysis access, you want to feel for that for that thrill. Okay. You want to palpate the carotid. Make sure that there's no bounding pulsations there. Okay. We can actually go ahead and after auscultating the heart, you want to look for any type of edema on the body, and we can actually go ahead and assess for the pulses. So we can do our radial pulses, and you want to do them at the same time to assess for symmetry. Okay. So radial pulses, and then we have the brachial pulses. Okay. Pedal pulses down here. Okay. And those are even. We want to do so we did the radial pulses, we did carotid, we did pedal pulses. We want to palpate the tibial and then the femoral. So the femoral pulse is again going to be in the groin here, okay? And then back here for the tibial pulses. Okay, good. Let's go ahead, and after, of course, we've done that assessment, let's go ahead and move on to the abdominal assessment. So I'll have you lay down flat for me, sir. Okay. This is the time you want to look for any type of pulsations. You want to look for bulging. You want to look for asymmetry. You're going to go ahead and do your auscultation first. And we're just assessing for vowel sounds in all 4 quadrants. We're going to go ahead and do our percussion. Good. And then we're going to do a soft palpation. And then we're going to go ahead and move into the deep palpation. And you want to note if you're having any type of discomfort, any type of pain from that. Okay. After you percuss your palpate and do your deep, we can go ahead and move into our muscular. So let's go ahead and do the muscular. Sir, I'll have you sit up for me. So you want to look at the patient's range of motion. So we kind of assess some of that muscularity when we have the patient raise their shoulders, turn their neck from side to side, against resistance. So what I'll have you do, can you raise your arms above your head? Good. And then can you put your arms behind your back? Good. And you want to listen for any type of crepitus with that. Go ahead and relax your arms for me. And then can you go ahead and turn your, good, very good. Okay. And so you would have them do the same thing with their legs. You'd have them extend their legs out. Good. And bend them. Good. And if they're laying flat, it would be helpful to have them bend their legs to their knees, or their knees to their chest, to assess for that full range of motion. Okay, so we're going to go ahead and check for muscle strength. Can you squeeze my fingers, sir? Good. And what I also like to do, can you pull against? Good. And push. Okay. And do the same with your feet. Push and pull. So you want to assess the resistance against you to feel how that strength is, that muscle strength is. Okay. Let's go ahead and let's move to, after we've done the toe, spread your toes for me. Good. Back together in your hands. So we've already went through the toes, fingers, joints, wrists, ankle movements where they pronated and supinated their hands and feet. So let's go ahead and move. Let's move to the back, where we can look at the spinal process, and then from there we can begin our neurological assessment. Okay? So again, you want to assess for symmetry here. Very good. Okay. You want to note any type of crepitus, any type of pain with that assessment. Okay. Good. So let's move to neurological exam. So we're going to be looking at the cervical part of that. Can you move your head from side to side for me? Good. Okay, can you put your chin to your chest? Good. And chin to the sky. Very good. Okay, you want to look at any difficulty with that? Obviously, he did very well. Let's do the finger to nose. Okay, so what I'll have you do is I want you to take your finger, meet my finger, then back to your nose, okay? Touch your nose, good. 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 Okay, good. So you want to look at coordination with that. I'm going to have you lay back flat for me. And I want you to put your shin, or you might want to scoot back a little bit, sir. You want to put your shin, or your heel to your shin and slide down. Good. So he does that straight down, and then with the other, please. Good. Very good. Okay. Go ahead and set up for me, sir. Okay, so let's go ahead and do the pronator drift. So if you could close your eyes for me and hold your arms straight out. And we're just assessing to see if there's any type of sway with that, which we should not see. Okay, so very good. Okay, go ahead and relax your arms. And we're going to do let's do the Romberg. Okay, so go ahead and stand up for me. Arms to your side and close your eyes. And we're really just going to be assessing to make sure that the patient doesn't sway, that they're able to stand straight with their eyes closed. And that really tests his cranial number 8. And it's just really assessing their sensory and their coordination. Okay, so let's go ahead and have you sit. Thank you, sir. So what we're going to do, I'm going to take my Q-tip to where I have the soft point and then the point where we broke it off. And we're going to check your sensory. I want you to tell me if you feel a sharp or a soft touch, okay?
Soft.
Good.
Sharp.
Good.
Sharp.
Good.
Soft.
Good.
Soft.
Good.
Sharp.
Good.
Sharp.
Good.
Soft.
Good. All right, next we want to take our cotton ball and we're going to look at the sensory on the face as well. So the patient would not know this, but we want to assess for the sensitivity specifically with the forehead, the cheek, and the chin. It works best in a shaven patient that you can really get to their chin, but just for assessment purposes. You tell me where if you feel anything and where you feel it.
Forehead.
Okay.
Cheek.
Okay.
Cheek.
Okay.
Chin.
Good. So we're done with our cotton ball. Okay, and next we're going to go ahead and do our deep tendon reflexes with our reflexor. Okay. You want to go ahead and have that leg suspended so that you can get a true assessment. Okay. So we get good responses there. And good reflexes there. And that was the patellar reflex. Next we're going to go ahead and do the bicep reflex. So we're going to have the patient relax their arm onto ours. Okay, so we got a reflex there. We're going to go ahead and relax your arm for me. Okay, good. So we got a reflex there as well. So that would complete our assessment. And I think we've covered everything there. So thank you so much for watching. We've covered, capillary refill. So when you're looking at the heart portion, you want to look and see how that capillary refill is. To give you an idea of circulation, you want to use warmth to make your assessments there. Okay, we looked at the clubbing in the beginning, so we really touched on everything, and I hope you enjoyed watching. Thank you.